Our website, channelstv.com, has more information on our top stories and others. Subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser, or download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms on Apple TV, Android TV, Fire TV, and Roku. We're staying with our coverage of the coronavirus spread across the world and in Nigeria. We shift our attention now to efforts being made to control the spread of the virus in the country. I'm joined on the news at 10 by the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Ihekweazu, who joins us from the nation's capital, Abuja. Dr. Ihekweazu, thank you for joining us on the program on the news at 10. Only one case so far has been confirmed in the country, though we're getting reports that some people are still being placed in quarantine in some parts of the country. How soon can we know their status?
So, Amarato, we've been preparing for this for the past 6 weeks, literally. And since then, we've had returning travelers that meet our case definition. Anyone coming from a country where there's established community transmission happening already. Initially, it was just China, and recently we've added 4 new countries to that list: Iran, South Korea, Japan, and Italy. Any of them who develop symptoms within 14 days of arrival, we take a sample. We've tested 15 people so far. Unfortunately, we've had 1 case come out positive. But why I say the 15 is just a demonstration that the system is actually working. So we are testing people that meet this case definition, getting results, and as you've seen with this individual in Lagos, when there's a positive case, we've been able to rally with the efforts of both the government of Lagos State and the government of Ogun State in mounting a response. Having said that, Amarachi, and it's important for Nigerians to know this virus really is circulating around the world. Over 50 countries have been affected so far. We will do our very best to prevent entry into Nigeria. But even if a case does happen, and a few more cases happen like we've seen, we really think we can work together with everyone concerned to pull this together. And Nigerians really have shown that we can come together in a time of crisis to respond to this incident, and that's exactly what we're doing at the moment.
Yeah, and it does seem inevitable that countries around the world will be affected, including Nigeria. The focus now is on the curbing of the spread of the virus. The Minister of Health did say at his briefing on Friday that the federal government has released all the funds needed by your agency to combat this disease. Can you tell us some of the things that are being put in place by the NCDC to control the spread of the coronavirus?
Yeah, thanks. So the Honorable Minister of Health has shown incredible leadership in this response, in really supporting us to mobilize extra resources. We need a little bit of extra funds to buy personal protective equipment, to support the establishment of treatment centers and their expansion to make sure that we have enough bed capacity in the 5 priority cities around the country. But really, nothing demonstrates the importance of investing in our health security more than this outbreak. The impact this will have on the economy of China, of the economy of the world, and potentially what we're trying to prevent on the economy of Nigeria has really been at the heart of what we've been preaching in Nigeria. That really, the best time to prepare for war is not after it has started. We really need to invest in our health security to enable us have sustainable, stable, and substantial funding for our health security investments. This is something that is a marathon, it's not a sprint. So we're very grateful for the resources made available by the federal government for this response. But this is really a plea to especially the state governments, their excellencies, the governors of all our states. Please, let this be an opportunity to really ask the question, how much are we investing in our health security? $1 today is going to save us a lot of millions of naira in the long term. And there's no better time to start planning for this than now. We need to be prepared, we need to prevent, so that we don't have to spend as much as we're doing right now on the response.
And I've heard some say that, we can fall back on existing structure put in place to combat the Ebola outbreak in 2014. If that is correct, can we actually rely on those same facilities, considering that this is a novel coronavirus? Scientists are still trying to understand it, the nature, the way it spreads, the way it multiplies and everything. Can we really rely on the previous structure with which we tackled Ebola?
Yes, Amarachi, one of the best investments that the federal government of Nigeria has made after the Ebola outbreak of 2014-15 was actually to set up the Nigeria Center for Disease Control. The NCDC has grown to be one of the pride of Africa as we build the expertise, and not just the buildings, it's really the scientific expertise, the 250 people that work 24/7 in the labs, on the surveillance department, risk communications, emergency preparedness to prepare for incidents like this. So the investments we need are long-term investment in thinking, in science, in developing the knowledge base that we need to respond to incidents like this. And we've done a lot. We have 23 emergency operation centers today in our 36 states. These are investments that we've made over the labs. We have 5 new molecular labs. Molecular labs are not easy to set up. A single one costs between 100 to 150 million naira. These are investments that we've made over the years. We've invested in a new digital surveillance infrastructure. We've covered 16 states in Nigeria. We're pushing for the remaining states. So these are the investments we make. The brick and mortar, the buildings, are actually the easiest part of this entire game. The more difficult ones are the scientific expertise, the laboratory expertise, the difficult reagents to get, the expertise that we're building. And that is the biggest investment we're making. The big request we're making now is for state governments to really join the federal government in this, because what we need is an all-of-society response. We need the private sector, corporate Nigeria, oil industry, telecoms, to come together and help us, because if we can prevent these outbreaks from happening, we protect their businesses, we protect the economy of this country, we keep ourselves safe. So, yes, some of that infrastructure has remained, but we've been improving on it. And the biggest improvement, really, is the small group in Nigeria that work at the NCDC together with our partners and other sister public health institutes to keep Nigerians safe every day.
Dr. Chikwe Ihekweazu, thank you for joining us on the News at 10. I appreciate, your time and, of course, your expertise on the issues. Know that Nigerians are behind you, especially as we find a solution to ending spread of the coronavirus.
Thank you.